Assalamualaikum and very good day, madam. My name is Nur Haikal Bin Nuzihan, and today I will be presenting about schizophrenia, a mental health condition which affects many people around the world. So I chose this topic for my assignment because schizophrenia is something that personally interests me. As a BMY student, I wanted to explore mental health disorder like schizophrenia and understood and how it was treated, especially in Malaysia. And schizophrenia is often misunderstood by people. And I want to dig deeper into the biological, social, and also psychological aspect of the disorder. By doing this, I hope to gain better understanding on how to create marketing strategies and awareness campaign to reduce stigma and to help people with schizophrenia. Okay, let's start by defining the schizophrenia according to the DSM-5. So basically, schizophrenia is a serious mental health disorder that affects how a person thinks, feels, and also behaves. People with schizophrenia may hear voices or believe that things that aren't true, which is known as hallucination and also delusions. So these symptoms make it hard for them to function in everyday life. According to the DSM-5 here, schizophrenia is diagnosed when these symptoms are prevent for at least 6 months and cause major problems in work, relationship, or daily activities. So schizophrenia typically begins in the adolescence of early adulthood, and also it affects both men and women, though men is usually develop it earlier. So let's move on to the first article literature review, the genesis of schizophrenia, an origin story by Bin Baum and also Winberger, released in 2024. This article looks at the biological roots of schizophrenia, particularly on how our genes and brain development influence this disorder. So, the authors focus on genetic changes and also how they affect the brain, especially during the early development. They use a variety of methods, including brain scan and genetic studies, to understand how these changes happens. The first key findings was that over 200 genes are linked to schizophrenia, many of which affect how brain cells communicate with each other. So the second important finding is that genetic changes are most active during prenatal brain development, suggesting that foundation of schizophrenia may be laid before, even before a human being born. Okay, so for the third key finding in this article is that disruption in the process of synaptic pruning, which helps the brain to remove unnecessary connection during the adolescence, can lead to schizophrenia. The fourth finding is that hormonal changes, particularly related to estrogen in women, may contribute to the later onset of schizophrenia. So, especially during menopause, a limitation for this study is that mainly it used post-mortem brain samples, which is not fully show that the early stages of the brain changes in schizophrenia. So the conclusion that we can make for the first article is that schizophrenia results from a complex mix of genetics and environmental factors. And also early interventions targeting brain development could help to reduce the risk or delay on the set of this disorder. Okay, the second article, titled Neurobiology of Schizophrenia, a comprehensive review, written by Lu Samyam in 2022. This article focused on the neurobiology of schizophrenia. So this article discuss how chemicals in our brain, like dopamine and also glutamate, play a bigger role in this disorder. So the authors explain that when these chemicals are not working properly, it can cause a positive and negative symptom to schizophrenia, such as hallucination and also difficulty of thinking. So they use a review of a several studies that look at brain scan and also genetic research and also neurotransmitter levels. The first finding is that problems with dopamine, especially in certain areas of brain, contribute to the hallucination and delusions. The second finding that I can find is that problem with glutamate, especially in NMDA receptors, cause cognitive and negative symptom in schizophrenia later on. Okay, the third key finding is that problems with synaptic communication in the brain due to the genetic risk factor can impair how neurons talk to each other. And the fourth finding is that the immune system may also play a role in schizophrenia, with certain immune genes increasing the risk of this disorder. So a limitation of this study is that mainly discuss secondary data from another studies, which can limits the ability to draw a conclusion from this new experiment. So the conclusion that we can make for this article is that we can emphasize that schizophrenia is not caused by one single factor, but also the combination of neurotransmitter issue, brain structure changes, and also the immune system factors. The study suggests that the future treatment should target this underlying biological mechanism. The third article by Li, Zhao, and Yi in 2022 focus on the gender differences in schizophrenia. So the authors explore how the disorder affects men and women differently, especially in terms of men usually develop schizophrenia at a younger age than women, and women often develop it later, typically on their 40s. The study also looks at the hormonal influence of schizophrenia, particularly how hormones like estrogen may protect women from some of the symptoms. The method used was a review of several clinical studies that examined the gender differences. One key finding is that men tend to experience more negative symptoms like emotional flatness and also social withdrawal. And the second finding is that women are more likely to experience affective symptoms like depression and also emotional instability, in addition to typical schizophrenia symptoms. The third finding is that women with schizophrenia tends to perform better on cognitive tests compared to men, particularly in the tasks related to verbal memory and also executive function. And the fourth finding we can look is that childhood trauma is a stronger predictor for schizophrenia onset in women compared to men. A limitation of this study is that mostly it relies on existing data. So real-time studies could provide more accurate results rather than this experiment. The conclusion is that schizophrenia manifests differently in men and women, suggesting that treatments should be tailored according to the gender specific symptoms and also hormonal influence by men and women. So, by understanding these gender differences, healthcare providers out there can provide more effective and personalized care. The The fourth article by Marx, titled Impact of Virtual Reality Based Simulation on Empathy and Attitudes Towards Schizophrenia, examines how virtual reality, VR, can be used to improve empathy and understanding of schizophrenia. So, schizophrenia is often misunderstood, and people with this disorder can face stigma and also discrimination, but the study aims to see if VR simulation of the symptoms of schizophrenia can help people, especially healthcare workers, better understand what patients experience. So the author used an experimental design where one group of participants experience a VR simulation while the control group watch 2D video. The participants' empathy, knowledge, and attitudes were measured before and after the intervention. So, for the finding of the study found that The group who used VR showed a significant increase in empathy and also had more positive attitudes towards people with schizophrenia compared to the group who watched the video. However, a limitation of this study is that the impact was measured not only immediately after the intervention, and long-term effect were not assessed at all. So the conclusion for this article is that VR is an effective tool for improving empathy and understanding mental health condition like schizophrenia. And it can be used in education and also public awareness campaigns to reduce stigma against schizophrenia. So, okay, now let's look at the schizophrenia in Malaysian context. So, in Malaysia, the term shared decision making, SDM, is not widely practiced, especially for schizophrenia patients. This study by Ismail and Midin explored how SDM is applied in Malaysia and what barriers exist. This study involves 331 patients, and it found that a younger and more educated patients were more likely to participate in this decision making about their treatment. The study also identified cultural barriers such as deep respect for healthcare professionals, which often leads to patient deferring to doctors. As we continue with the finding from the study, it was found that patients with better insight into their schizophrenia were more likely to engage in decision making. So this means that when patients understood their condition more clearly, they felt more confident in participating in decision regarding their treatment. So on the other hand, those who lack insight into their illness were often less engaged and deferred decision making to their healthcare providers. This insight can vary greatly depending on the severity of the illness and the patient level of awareness about their condition. So the study also showed that a younger patients and those with a higher education were more likely to actively participate in treatment decision, which highlight the critical issue in Malaysia, where that may be a gap in health literacy that impacts how patients view and understanding their mental health. So the cultural factor also play a significant role as respect for the authority figures such as doctors, psychiatrists is deeply ingrained in Malaysian society, often leads to patient differing decision to their doctors without challenging them. However, a key limitation in this study is that only look at the patient who one outpatient clinic in Malaysia. So the result may not be fully representative to all regions or healthcare setting in the country. Nevertheless, the conclusion is clear. Improving patient involvement in healthcare decision requires addressing a cultural barriers, enhancing educational around the mental health and improving patient insight into their conditions. So this approach could ultimately lead to a better treatment outcome for schizophrenia patients. Okay, next, the second overview looks at the coping strategies of caregivers for schizophrenia patients in Malaysia. So the study by Kamaro Bahri focused on the emotional distress experienced by the caregiver and how they cope with the demand of caregiving. So the study found that caregivers who had more social support were less stressed and used better coping strategies. The research also highlight gender differences in coping, with women more likely to use emotional coping methods, while men use problem-solving strategies. The study also found that caregivers' age and duration of caregiving influence their coping strategies. So older caregiver and those who more years of experience were more likely to use a passive coping methods, leading to higher distress. So a limitation of this study is that It only collected data at one point in time. So it doesn't show that caregivers' coping strategies changes over the long term. The conclusion is that for this article, caregivers need more support, particularly through social network and respite care to reduce their distress and also to improve the care they provide. So in conclusion, this literature review has helped me to understand schizophrenia from various perspectives, including biological causes, impact on patients, caregivers, and the importance of the decision making in the treatment. So the findings from the studies discuss the need for more and an inclusive patient-centered care, especially here in Malaysia, where cultural and social factors plays a significant role in the treatment and the care of individuals with schizophrenia. So as marketing and psychology student, I can use the knowledge to create campaign that can reduce the stigma, discrimination, and to raise awareness about mental health, especially schizophrenia, ultimately improving the lives of those affected by schizophrenia. So that's all the presentation from me. Wabillahi wa taufiq wal hidayah. Assalamualaikum warahmatullahi wabarakatuh.